Concussion research and treatment has expanded exponentially in the last few years. With so much new information coming out, it can be hard to decide what to trust. Let's talk about a few common concussion myths and the truth behind them. Myth number 1, you're stuck with permanent impairment after concussion. While concussion is a very serious brain injury, research has shown that it's treatable. The most important thing to keep in mind here, if you think you have a concussion, see a trained healthcare provider. The main reason that concussions can cause lasting damage is that people with a concussion don't seek treatment. In fact, with targeted treatment and rehabilitation, you can feel 100% back to normal, usually within 3 weeks of the injury. Myth number 2, the best treatment for concussion is rest. This one has been proven wrong time and time again. In 2016, concussion experts from around the world got together to create a consensus statement on concussion. One of the main agreements that came out of this meeting was that prolonged rest after concussion is dangerous. They agreed that a brief period of rest, about 24 to 48 hours, was all that's needed. After that initial couple of days, a gradual return to activity is the best way to get a patient feeling better quickly and safely. Myth number 3, you have to have loss of consciousness to have a concussion. In the past, loss of consciousness was one of the main things that coaches and sideline personnel looked for as a warning sign of concussion. While loss of consciousness can certainly indicate a concussion, it's not a requirement to diagnose concussion. In fact, 90% of concussions happen without a loss of consciousness. That's why it's so important for sideline professionals to know the more subtle signs of concussion, like confusion and dizziness. There you have it, 3 of the most common concussion myths debunked. Have more questions about concussions? Visit baselinetesting.com and fill out the contact form if your questions aren't answered there.